Hi, and welcome to Pennsylvania Newsmakers, and thanks for watching. Well, the primary elections are over, and the legislature returns to take up Governor Rendell's budget for the new fiscal year. Speaking of Governor Ed Rendell, he's our special guest when Newsmakers returns.
This is Pennsylvania Newsmakers, a fast-paced, unrehearsed weekly discussion with and about the leaders who shape your world. And now, here's your host, Terry Madonna.
Hi, welcome back to the program, and again, thanks for watching. Well, we're delighted to have back with us, as often is the case, Governor Rendell, who's come here to chat about his budget and a couple of other items. Let's get right to it. Governor Rendell, welcome as always.
Hi, Terry. Nice to be back.
Hey, before we get, we want to talk about mass transit and roads and bridges and health care. I know that's what we want to get to. But I want to ask you about the Act 1 bill, or the votes in the school districts that overwhelmingly went down. And here's what I don't understand. When you ran, you said, let's do the income tax. You were willing to do that. You were willing to do the sales tax. I think, quite frankly, the legislature sort of forced everybody into this school district switch, which for the third time has not worked. Right. Where do you think this all goes now?
Well,
what would you like to see happen?
Remember, I never thought this was a good idea. I did it because that was part of the price of getting the whole property tax reduction package passed.
Right.
But as you're right, it didn't work with Act 50
and 72.
And 72, and it certainly didn't work at the election on Tuesday. And it shouldn't work because it's a complex issue. Voters never can understand it quite properly, so when they don't understand something, they vote no. Right. Secondly, there was so much leeway that a lot of the school districts put in the property tax reduction at half of what it would be, because this year it would have been only for 6 months.
Right.
So the referendum said you'll save $480 on your property tax. When truth be told, in every full year they'd save almost $1,000.
But conceptually, you didn't.
No,
conceptually,
it's buck passing. It is buck passing. Yeah. If we're going to do tax shifting, and remember, the good thing about gaming was we were able to reduce property taxes without raising any other property tax. But if we're going to go further, and I think we should and we have to, then we have to tax shift. And if we're going to do tax shifting, let's face up to it and do it in Harrisburg. That's where the states that have effectively done tax reform have done it. They didn't leave it up to local districts. They bit the bullet. The problem is, Terry, that some of our legislators, not all, don't want to vote for a tax hike, even if 100% of the tax hike is going to reduce another tax.
It's a reason because they think that the school districts will get the credit for it, but they'll get the blame for it?
I mean,
is that part of it?
One legislator explained it to me this way. He said, Governor, you don't understand. If I vote for a sales tax increase, 2 days before my reelection in November, someone will send out a mailer and say, Representative Jones voted for the biggest sales tax hike in history. And they won't explain that 100% of that sales tax hike went to property tax reduction. My answer to that is, that's what your campaign is for.
Right.
You should be out there saying, yeah, I gave you the greatest property tax reduction in history, and we did it in part by tax shifting.
What was interesting to me was that this is not an issue that broke down ideologically. No. I mean, you had, Representative Sam Lord, there's probably no more conservative House member who put some ideas on the table. Then you had even a lot of Democrats who were willing to support it. It's a weird thing because both Democrats and Republicans, liberals and conservatives, in theory, or at least in practice, would go around saying, we're willing to do this, but then when it came time to do it, they just couldn't do it.
Well, you saw what happened last year. I said that I would go as far as, supporting and signing a sales tax increase of 1% if the legislature passed it as part of the property tax relief package. It failed in the House narrowly, and I was told in the Senate it didn't have 15 votes.
No chance.
Yeah, no chance.
Yeah.
So, I mean, if people really want a property tax shift, and they want property taxes to go down and sales tax or income tax to go up, they should get in touch with their legislators as soon as possible.
Okay, one other question, and then we'll take a break and we'll come back and do the other things we're talking about. But this is pretty important. I mean, I want to stay with us a minute. We have now 1 in 5 members of the legislature is new. I think they're more conservative than the people they replaced. We'll see. Some of them elected on a no tax hike pledge, as you know. how optimistic are you that they'll have the fortitude to take this issue on, which everybody agrees is important? Not that we don't agree, right?
Well, it's interesting because a lot of them were also elected on a property tax reduction platform.
That's right. Yeah.
So it's a quandary for them. And, you know, in politics, there are almost no easy decisions. There are almost no free rides.
Right.
The reason I was able to achieve property tax reduction where all other governors failed is because I gave a free tax reduction to them because of gaming. That was easy to vote. And by the way, as you know, Kerry, the gaming proceeds are doing so well, we're going to far exceed $1 billion in property tax reduction when we're fully up and loaded in either 2008 or 2009. But now it's bite the bullet time. And I think we've got to do that. Now, we'll see. I'm not optimistic, but I'm not pessimistic. We'll see.
Okay. All right, I'm chatting with Governor Ed Rendell. When we come back, we're going to talk about mass transit, roads and bridges, a big issue in the state. We'll deal with that when we return.
This broadcast of Pennsylvania Newsmakers is presented by the Pennsylvania Chamber of Business and Industry, the statewide voice of business. This broadcast of Pennsylvania Newsmakers is presented by Pennsylvania Medical Society. Doctors and patients, preserve the relationship. And by the Pennsylvania Manufacturers Association. Business in Pennsylvania is our business.
Hi, welcome back. I'm talking with Governor Ed Rendell. We're chatting about his agenda. It will be back before the Pennsylvania General Assembly. Actually, it's just getting introduced, and so they're going to take up the budget in earnest, we hope, Governor. Governor, let's talk about some pieces of it. I mean, we'll have time in later shows, hopefully, to get into the details of your regular budget. But let's talk about a couple of these programs. There is no doubt that the state has a very serious problem with roads and bridges and mass transit. $1.7 billion every year is needed for some period of time. You can tell me how long to take care of the problem. Everybody agrees, but no one can agree yet on the funding. You've offered, put a proposal out to lease the turnpike. Let's talk a little bit about where you see that piece of it is right now.
Right. Well, let me start by saying the $1.7 billion that you've identified is about $1 billion for roads and bridges and about $700 million for mass transit. That's the Transportation Reform Commission's findings. Independent commission, bipartisan.
But no one's challenged that.
No one's challenged that, but everyone, again, in Harrisburg, nobody wants to pay for anything. We all want to spend the money, but nobody wants to pay for it. Well, I have devised a way, I think, to meet both of those goals, mass transit's needs and highways, roads, and bridges, without having ordinary Pennsylvania citizens pay for it. The first is to follow what the state of Indiana did and the city of Chicago. Interestingly, Terry, a conservative governor in Indiana, Mitch Daniels, who used to be President Bush's OMB chief, and a progressive, liberal, Democratic mayor, Rich Daley, they did the same thing. They leased a toll road to a private company, maintaining control over tolls, over maintenance schedules, and they leased the toll road, got a significant money up front, and invested that money into their transportation needs.
Into the roads and bridges and mass transit.
We believe, and our financial advisor, Morgan Stanley, convinces us, and the response we've gotten so far, is that if we lease the turnpike, we could get, a 99-year lease, we could get for the next 30 years at least a minimum of $1 billion a year. That's annuitized. Not $1 billion up front that we spend and $1 billion a year, because the lease price would be something in the range of $12 to $14 billion, maybe more. At that rate, $12 billion, it produces $1 billion a year annuity, which we use to address the problems we have with our bridges, highways, and roads.
Let me go to another aspect of this. I noticed that in Texas, where they passed the legislation but haven't done it, there's some concerns about whether or not we could get a handle on rate increases that the public would have to pay.
That would be in the, that would be.
So your point is you want very strict controls over what the private however that.
All of that would be laid out in the final request for proposals. This would be an auction. We would lay out how often and to what degree tolls could be raised, what type of maintenance schedule they'd have to adhere to. And then we'd see how high the price is. If the price isn't high enough, we don't go through with it.
All right, let's talk about, look, the other option is to use some kind of a tax, and now we're back to that thing we just talked about a moment ago. legislatures have been reluctant to increase gasoline taxes,
and they should
because of the among other things.
Should be.
Go ahead.
Price of gas this year could be $4 at the pump. We can't burden our riding public. We can't burden. I don't think I would sign a gas tax increase, and I've pretty much made that clear. So we have to look for creative alternatives. This has worked in Indiana, it's worked in Chicago, and we can do it here. You know what the underlying objection is? In one, there's this thought that we're giving up a state asset, but we're not giving it up. We're leasing it.
Yeah.
The difference is, I explain to people all the time, if you sell your house, the new owner can paint it chartreuse. You may hate that, nothing you can do about it.
Yeah.
If you rent your house, they can't paint it without your approval. That's the main difference. And the second thing we hear about is, well, both parties, Republicans and Democrats, have a tremendous amount of patronage jobs on the Turnpike. Both parties, for the last 30 years. The Turnpike's made up of 2 Republican members, 2 Democratic members. It's a patronage haven, and the legislature didn't want to give it up.
Let me ask you this: you put this proposal out, I think, in your budget message, in February, for the first time. It got big play, and you introduced it. Okay, we've got the problem. No one has suggested for a moment we don't have the problem. You agree with that?
No one.
All right.
Sam Smith made a sort of foolish statement that if it's a problem, let local and county government pay for it. You can't do that. It's silly.
Have you heard any other suggestions made by... So, in other words, I mean, you've also suggested maybe we tax gasoline receipts. I don't think oil profits. You don't want... I mean, that's not high on your list, is it?
No, but I think it's an alternative, and the legislature says, well, it can't be policed so they don't pass it on to us. Well, Exxon is fighting in every way it can to keep this from happening. If they could pass it on, if they were certain they could pass it on, Terry, why would they be fighting?
Okay. I mean, we're going to go to health care. We've got to take a break now. But my point was, I mean, I've been listening for alternatives that sort of make sense. I haven't heard any. And this is a thorny problem. And, we've got, what is it, the second largest number of roads in a state, run by the state, not by local governments. And
the largest number of bridges, 5,900.
And there are a lot of them in a state of disrepair.
And let me also say one thing. It's not just Philadelphia and Pittsburgh on mass transit.
I understand.
I was in Altoona for the rally. In Altoona, they are third week in June, ending nighttime and weekend bus service in Blair County.
All right, we're going to switch gears. When we come back from this break, we're going to talk about health care, another ambitious agenda of our governor, who has a very ambitious agenda out there for the voters and the legislature to consider when we return.
This broadcast of Pennsylvania Newsmakers is presented by the Pennsylvania Credit Union Association, Pennsylvania Credit Unions, where people are worth more than money, and by the Energy Association of Pennsylvania, Pennsylvania's energy information source. This broadcast of Pennsylvania Newsmakers is presented by the State System of Higher Education, 14 state-owned universities. The state system is the largest provider of higher education in Pennsylvania. And by the Hospital and Health System Association of Pennsylvania, working towards a healthy Pennsylvania.
Hi, welcome back to Pennsylvania Newsmakers for our interview with Governor Ed Rendell. We're talking about his agenda, at least that part of the agenda that we all consider to be... Do you object to that term, ambitious? All of us say aggressive,
it is ambitious, but ambitious on behalf of what I believe are real needs of people. Yeah. We're going to talk about health care. Yeah. Health care was identified in last year's campaign as the single most important domestic issue, not only for the uninsured, but for people who work and get health care through their business. They're scared to death because they see other businesses dropping health care, or they see the employee contribution going up so high that often employees can't afford it. So we have to do something about 2 things, Terry. One, accessibility to health care. We got to make sure that everyone in this state has the ability to get affordable health care coverage. And 2, we've got to constrain costs. Consider this incredible statistic. In the last 7 years, health care premiums have gone up 75%. Inflation, 17%. If we go through 7 more years like that, there will be no health care.
Can we take those 2 pieces and talk about them in more detail? I moderated a panel for the Hospital and Health System Association, which Dave Wilderman, a guy from Organized Labor, you know him well, said that he didn't think the employer tax was a go. One of the ways you want to fund for the 900,000 uninsured folks is to use a tax on employers.
Who don't provide health care.
Who don't provide. He says that's a non-starter because it's asking the employers in a whole group of the general population to pay for it, particularly exempting big business. The weight would fall on the small business, and he thinks...
Now, the employer tax is all businesses.
All businesses, even though, regardless of the size.
If you have 2,000 employees or 6 employees.
All right, well, but the bigger point is this. He thinks there has to be a way to find a broader source of income. We're back to who's going to pay for it again. Have you heard that? Is there some...
Well, I think the legislature is reluctant to place it. We call it the health care assessment.
Right.
You have, as an employer, now that we're offering this affordable $170 a month for an employer to provide a good basic health care package for their employee. If you don't take it and you don't insure your employees, you get a 3% of payroll assessment. And every state that's launched this, Massachusetts, California, Illinois, has a similar assessment, and they're going to get them passed.
Yeah.
That's number one.
But let me just, so I understand this, but isn't there an incentive then for large companies to drop their coverage? Go ahead and take it from there.
No, because they'd play the employer tax. You either cover or you play...
Yeah, but they're spending more than 3% in most cases.
But
go ahead.
But you'd have to, first of all, you'd have to go bare to do this for 6 months.
Okay.
And almost the experience, New York's had this program for 3 years.
So you're saying they wouldn't drop it. Okay.
That's number one. But number two, it's interesting. It's the other way. We, for 2 years, surveyed small businesses who don't provide health care. And we said, at what price would you opt into providing health care for your employees? They said between $100 and $200. Now, why? Because they want to provide health care if they can afford it, because their employees don't leave as quickly. If you don't provide health care for your employees, you're going to lose the best of them.
I don't think small businesses, you agree or disagree, I don't think they're saying, well, we're not going to supply because we don't want to. I think we have a lot of small business folks on this program. I think they want to provide it.
If we can give them an affordable package.
Yeah, you hit the point. It's so expensive.
But let me go back to the health care assessment. Walmart has taken great steps, and now they do provide health care for their employees.
Right.
But let's roll the clock back 5 years ago. Does anybody watching us think that Walmart, perhaps the most successful company in the United States of America, shouldn't provide health insurance for their employees, and thereby passing the cost of the health care that those employees get in an emergency room to all of us?
To all of us, yeah.
Your station, right here, Terry, pays 6.2% of its premium that it pays to provide health care to all of you is absorbed by costs of providing health care to the uninsured. So your company is paying for the free riders. And what my point is, should Walmart be a free rider?
Oh, no, I understand. No, I understand that point. But to go back to the politics of it in the legislature, because obviously that's where this has to be resolved, obviously with you and the legislature, you have not heard, if some say that the tax on business is inequitable, it falls on only a small portion, but have you heard any other idea floated around?
Of course not.
See, I mean,
so it's back to the.
I'm trying to get to, if we're going to do this, everybody wants this. I've done polls on it. The voters, of course, overwhelmingly want these. Not argue the number. Let's say 900,000 just for our conversation, uninsured. Everybody wants this done, but it's going to take a lot of money, and who's going to pay for it?
But interestingly, I don't think it's actually money, because the employer assessment pays about 7.5% of the total cost.
All right.
If the legislature scotched the employer assessment, could we continue to fund this? Sure, we just have to raise the cigarette tax instead of 10 cents a package to maybe 14 cents a package. But where it would collapse is, then, if there's no assessment for not providing health care, then employers are going to say, well, what the heck? Even though there's an affordable package, I'm not going to provide it.
All right, when we come back from this break, we're going to talk about the second piece of that, and that's trying to drive down health care costs. Everybody agrees health care is expensive. It needs to be driven down. We'll check in with the governor in a moment on that subject when we return.
This broadcast of Pennsylvania Newsmakers is presented by Highmark Blue Shield, changing the way health plans work for business with a variety of plan options for employers and more choices for employees. Information is available at highmark.com. Have a greater hand in your company's health. And by the Pennsylvania Healthcare Association, the future of long-term care. This broadcast of Pennsylvania Newsmakers is presented by the Pennsylvania Builders Association, building today for a better tomorrow, and by the Pennsylvania Cyber Charter School, bringing educational innovation and freedom to the children of Pennsylvania.
Hi, welcome back to the program. We're chatting with Governor Edward G. Rendell about his ambitious program for his second term. Governor Rendell, the other piece which is very important is driving down health care costs. And let me ask you what I think is a tough question. One of the problems that we hear is that many of the ideas to drive down health care costs, in a sense, cost money themselves.
No.
Meaning,
it's not true. For example, that's not true of all of them. Technology for the healthcare delivery system would probably cost nationwide $100 billion up front. It would save $30 to $40 billion a year. But there are many ideas. Just take one. Hospital-acquired infections. You know the hospitals have to report to the Cost Containment Council.
Yes, we've done shows on that.
$3.5 billion in 2005. 20,000 cases of hospital-acquired infections. In Scandinavia and Europe, there are almost no hospital-acquired infections. The VA hospital in Pittsburgh has reduced its most prevalent form by 50%.
Now, don't you think hospitals, given the work of the council, my sense is they're doing better.
Hospitals want to do it?
You don't think they're doing a better job of it?
A few are now having pilot programs, but no one feels a sense of urgency. And we're going to make them feel a sense of urgency because, number one, the state of Pennsylvania, 20% of all of the insured people are insured by the state. We're going to stop paying for hospital-acquired infections.
Right.
No other business, Terry, would someone pay for having something done, an appendectomy, and then having another illness crop up because of the hospital's failures. We're going to stop paying, and number two, we're going to make a condition of licensing and relicensing that you're making progress attacking your hospital-acquired infections. And the beauty of most of the cost-saving things that are in our plan is as they cut costs, they help patient outcomes. 20,000 people in 2005 got hospital-acquired infections. If we can eliminate them, we're benefiting them as well as saving costs.
We have about 30 seconds. Medicaid budget's controversial. Do you expect cutbacks in the eligibility and other programmatic? You think you can get by without cutting it?
We asked Estelle Richmond before we submitted the budget to cut $500 million out of the budget. She's already done that. We can't cut any further.
And that's controversial in the legislature too, right?
Sure. But it shouldn't be controversial because it's not about welfare. It's about health care.
I got it. All right. Governor, thanks.
Thank you.
All right, there you have it, our interview with Governor Edward Rendell. Stay with us next week for a special edition of Pennsylvania Newsmakers, and stay well.